talking about women's health this morning, and when it comes to their health, women are generally quite good. We're quite open about talking about it and also going to see the doctor. But it turns out there are some areas where we could do a bit better.
Well, here today to tackle some of those areas, Dr. RADHA Modgill. First off, we're talking about menopause, and that is today's 60-second surgery.
The menopause marks the end of menstruation for women. In the UK, the average age for a woman to reach menopause is 52, although some can experience the menopause in their 30s or 40s. It's caused by a change in the balance of the body's sex hormones in the bloodstream and can cause a wide range of physical and psychological symptoms. This can include hot flushes and night sweats, loss of libido, discomfort during sex, heart palpitations, headaches, sleeping problems and mood changes, including depression. If your symptoms are mild, you may be able to manage them yourself without medication through exercising, reducing stress levels and avoiding certain foods, but there are treatments available. One of the main treatments is hormone replacement therapy, or HRT, which helps to relieve menopausal symptoms by replacing estrogen, and it's available in many forms. The type of treatment suitable for you will depend on your symptoms, preferences and your medical history. So if the menopause is interfering with your day-to-day life, visit your GP and discuss your options.
Now, Dr. RADHA, as a 53-year-old woman, I have to say I'm very interested.
Yeah.
My ears prick up when we talk about menopause. If there are people watching, women watching, saying, I'm not sure if I've got the menopause or not, is there a simple test that you can have done that tells you whether you are or not? Absolutely.
So there is a blood test you can do which looks at the FSH, which is a particular type of hormone. You'll start to notice your periods becoming more irregular, you might get some hot flushes. So those are the first kind of symptoms you may get. And at that stage, go and see your doctor and they can advise you about a blood test and talk to you about your symptoms.
And also you mentioned there in that film that can start much earlier for some women. So if you are getting any of those symptoms and you're younger, still go and get that checked.
Absolutely. So we always tend to think in the 50s or mid-50s it's going to happen, but there are some women, about 5%, who actually have the menopause before 45 years of age. So it's not unheard of, and if you are concerned, then do go and see someone as soon as possible.
What about keeping it at bay? Where do you stand on hormone replacement and any sort of other tablets or injections?
So I think the main thing to say about the menopause is that everyone's reacts differently to it. So some people will be affected dramatically, other people will have quite an easy time, but HRT is a possibility.
My mother always says if she did go through it, she can't remember it. She was too busy to worry about it. So it's interesting what you say there.
Absolutely. So if you are, the time we use HRT is if you are having symptoms and if you are being affected by those symptoms. So it's really to stop those symptoms or make them better for women. And HRT is useful in its right place, but I think the key is it's based on an individual, so you've got to go to a doctor, you've got to talk about your individual health risk, your family history, if you've got high blood pressure or clots or other medical problems, and they will help you make that decision, because there are some risks. So, for example, slightly increased risk of breast cancers and heart disease with HRT, so it's not without its risks.
I know some women like to work with diet and maybe supplements. Is that something that you think is useful?
Absolutely, and again, if you can get away without using HRT, then absolutely go for it, because things like exercise, avoiding spicy foods, which may make those hot flushes worse, are very helpful. Good sleep, and also being aware of what the menopause actually means, and also talking to your partner about it.
Supportive partner is very important.
I think supportive partner is very important. I do think it's very important to understand why the person with you is so irritable or irascible or annoying.
I think he was talking.
And also to bear in mind that, of course, men go through their version of this as well, and so many people give no understanding to men of a certain age who have all this.
Yeah, so I think the key is that you need to tell people what you're going through, because otherwise there's miscommunication. People don't understand why you're behaving like that or why you're feeling like that. And a lot of the time when I see patients, I really say to them, please go and talk to someone about what's happening at home, because otherwise they just feel frustrated and it gets a lot worse.
Now, here's an interesting thing. It'll come as a surprise, I think, to many of you, but there is a killer disease out there that affects more women than men. It's a bigger threat to women than breast, ovarian and cervical cancer put together, and that is?
Heart disease, yes. So the typical stereotype we have is of an overweight 50-year-old man who's having angina, but that's completely been blown out of the water now. So what we're finding is there are lots more women who are suffering from heart disease. I think about 30,000 women a year die of heart disease in this country. So we really need to change our thinking and to update our view about who suffers from heart disease and target those women.
So how would you know that you've got the start of heart disease?
Yeah, so obviously if you are starting to have angina or chest pain symptoms, it may be that you've already got it and the arteries in your heart are already being blocked up. What we want to do is try and get people before that happens. So what we're encouraging people to do is to go to their GP, certainly if you're over 40, to get your blood pressure checks, your cholesterol, your height, your weight, and also talk about your family history. So we can get...
Well, most GPs just do a kind of general MOT for you, if you say, I just want to check up.
Absolutely.
Yeah.
So over 40, all GPs are offering health checks for all of those things. If you're under 40 and you already have a history of high blood pressure or other risk factors, overweight, then you can go and also be tested for those things as well.
I mean, it's quite shocking. Coronary heart disease kills 3 times as many women as breast cancer. And yet you're right, whenever you say heart disease, you normally think of men.
Absolutely, and this is what we really need to reiterate and to try and get out there, is that, you know, we're all at risk of this heart disease. We all have
Especially
to...
if you have cigarettes, drugs, alcohol.
Absolutely.
Involved.
And what about cholesterol? Is that a big factor?
Yeah, so cholesterol is a big factor, and actually a lot of women, I think about 2/3 of women didn't know what cholesterol was actually. So we need to educate people. It's a fatty substance in the blood. You can easily get it tested at your GP, and there are lots of things that we can change in our diet, and also exercise and weight loss, which can help.
Now, Dr. RADHA, everything you've been talking about there, what we do on the programme, because you're new to the programme, you're going to see this now. We go over to the hub now, and there's Christian, and Christian's been looking at the top health-related topics being talked about women online today. What can you tell us, Christian?
Well, I actually cast my net across the whole year and looked at women's health topics and issues and the main topics associated with them across all social media. And here is a word cloud of those. The one that dominates is weight, followed by pregnancy and breast cancer. And interestingly enough, talking about heart disease, it's the sort of least most talked about thing that I could pick up. When you correlate that back to things like weight, diet and eating, they seem to be dominating that type of discussion. So quite a thing there. And also breast cancer seems to be very large as well. So a lot of talking points there. What do you think about that? Does that surprise you?
It kind of backs up everything Dr. RADHA's been saying there, doesn't it? Which is, we think breast cancer, big killer for women, and yet the heart disease there was very tiny. But interestingly, weight. Women just talk about their weight constantly.
I know. I mean, obviously, weight is an issue in terms of healthy living and heart disease as well, but I think really we, unfortunately, are getting lots of images about image and what we look like, and that's probably why that's the biggest topic. But yeah, heart disease is tiny, and we really need to try and balance up those words so that we are aware and we can actually try and target people before it happens.
Though in fairness, if you get the weight thing right, the other things will improve,
yeah,
won't
that's
they?
true, and that is a risk factor, as you said. So there are a few risk factors in that word cloud which actually will help prevent heart disease, so it's important.
Well, Doctor, we'll say goodbye to you. Thank you very much indeed. I have a few
very
things
much.
I'd like to talk to you personally about.
She hasn't got all day.
During the commercial break.
Afterwards.
Okay, we will do
And if you'd
that.
like any further help or advice on anything we've discussed there with Dr. RADHA, go and have a look at our website. Lots of information for you there.